Everyone, good morning, good morning. It's New Zealand time. Good morning is 25 past 7. It's our morning. What about you? Is it your morning or your night time or your afternoon time? Okay. Good morning. I'm Szenan from Center of Balance, the acupuncturist. Now, we have a few platforms that going at the same time. Now, in my clinic page, in my practitioner page, on YouTube, on Facebook, and Instagram, so you can see me on a lot of different platforms. Yeah. Put 4 camera in front of me so everyone can see me. Okay. Now, what is the topic today? Today is about neck pain again, and we're going to talk about when, if you suffer from neck pain, when is the best time? When would you need to go to see a doctor? Well, most of us, we have neck pain. You don't go to see anyone, right? You just suffer because it does get better. A lot of neck pain does get better itself, gradually. So, but some neck pain, you really need to go to see your doctor or a practitioner straight away. Right. Now we're going to talk about this. It's more for patient, but as well as for practitioner, acupuncturist, if you're an acupuncturist, because this information, you need to gain this information to suggest your patient, to let them know when is the best time to see a doctor or to find and come and see you if they have any neck pain next time in future, right? They might not be having any pain right now because through your magic hand, right? You treat them well, right? All right. If you are on this, good morning, Veronica. It's expecting you every morning. Okay. Now, if you're on my live now, no matter where you are, no matter which platform is that, please give me a thumbs up and say hello to me. Yeah, this is important. All right. So, because I would like to know you. I'm very good. Thank you. Very good. All right. I'm going to Auckland today, so it's going to drive back 1 hour something. I don't know because they changed the route now. Some of those expressway the new expressway. We're going to try the new expressway, and it should take us faster to get to where we want to go. All right, it's a Sunday day, so please, if you watch this video, please give me a thumbs up and say hello to me and share this video out and tag your friends. If you're a practitioner, tag your family, your friend, whoever suffer from neck pain into this live video. Tag your colleague, if your friend who's studying Chinese medicine, acupuncture, or who is an acupuncturist right now, tag their name into this live video on Facebook. And if you're a patient of mine, tag your family name, whoever would like to know this information about neck pain, right? In the next couple of days, we're going to talk about neck pain treatment, right? What sort of treatment in Chinese medicine, in acupuncture, or what sort of treatment in Western medicines, right? Then what else will we talk about? We're going to talk about what can you do for yourself at home through some acupressure point, Now, apart from acupressure point, what should you change? Try to change your lifestyle to maintain, to get your neck pain better. Some neck pain, it not seem to be able to get better. Arthritis, people thought that they should live with arthritis. That's not true. Right? You can get rid of the pain, even you suffer from arthritis. Right? It doesn't mean you have to suffer from the pain. We have different idea, different theory, and according to Chinese medicine. Right? So if you watching replay of this video, please just fast forward to about 4 or 5 minutes, right? Because we talk something and say hello to everyone, so they spend some about 4 or 5 minutes, so you can speed up on Facebook and YouTube to this video go faster, so you can in this video faster. Right, I know a lot of you are watching replay. Okay, right, let's start. Right, about neck pain, right? When to see your doctor? Right, of course, we talk about muscle strain. Right, the reason for muscle strain, probably you sleep in wrong position, you reading or playing your cell phone, on a bad position, poor posture, that causing pain or injury. Suddenly jump your neck like this, and it get hurt. Now, if those symptoms are mild, you know, it just, I can feel it, but it doesn't actually stop me doing anything. If you suffer from that, or your patient suffer from that, sometimes it doesn't need to get any treatment because it will heal itself. Our body amazing, you know. If your organs are strong enough, like what organs? Like we talk about stomach and spleen, they control muscle. Kidney and bladder control bone. Liver and gallbladder control joints and tendon and ligament. So if those organs are strong enough, which means your um, bone, joint, tendons, muscle, they have their own strength. They have their own strength. What about heart? Heart is important too because if heart is weak, it can push the blood through all the organs, all the entire organs, and the bone, all the structure things. Because you need blood supply to really get healed. Without blood, there's no healing. So heart function is better. It's important too in here. And what about lung? Is lung important? Yes, lung is important. Why is that? Because in the blood, what's helping the organs and the structure to heal is the blood, right? What is in the blood helping them to heal? Normally we talk about two things. One is oxygen. You can't go without oxygen in the blood to get your body to heal, right? And so what organs directly connect to oxygen? Your nose, your lung, right? You have to have a healthy and strong lung to be able to breathe in your oxygen, get the oxygen into your body and into your blood to be able to get you healed. Right. So all organs are important. All organs are very important. Okay, not just one organ. Not just one organ. Right. Then okay. Now we know organs are important. If you gain all the organs healthy, if you have a healthy organs but you hurt yourself in bad position, it can heal itself. It can heal itself. Then you don't have to see a doctor. You don't see a practitioner. Why is that? Because it's just heal itself. 1 or 2 days, it's gone, and it's not a severe pain. But in some cases, it actually get a sharp pain, very severe pain that prevent you to sleep. You can't sleep, you can't do things, you can't do your normal duty, you can move your neck, and the pain is quite unbearable. Then you should straight away to see your doctor or straight away go to an acupuncturist. Straight away go to an acupuncturist. Okay? And then we will help you to get better. In our clinic, we treat a lot of neck pain. And with our technique, we use balance method acupuncture, scalp acupuncture, 猪丹胶, and tongue There are a lot of scalp acupuncture techniques. And we use G acupuncture, we use trigger points, what else we use? Balance the pose, acupuncture spirit, all this, we have more. A navel acupuncture on the belly button, you know, all this are very good for pain, for your neck pain. Now, we can even help you to get your organs function better, to help you heal better. Right? I always say that acupuncture needle doesn't help people, doesn't heal people. It's the if your body itself heal yourself. The needle is trying to bring the blood through the entire body and trying to balance the organs, get the organs function better. When the organs function better, your body heal itself. Acupuncture has a limit. Acupuncture don't heal you, but your body heal yourself. But through acupuncture, we get your organ function better. We improve the blood circulation. That's why your body heal yourself. Does it make sense to you? All right. I try to make it simple. Okay. What are those neck pain you should go to see your doctor straight away? Consult with your doctor. Now, most people, or in a textbook, will say, well, if your symptoms persist for more than 1 week, consult your doctor. Right? You should also see a doctor if you have the following symptoms. Okay. Severe neck pain. But I have to have a say about this. When your symptom persists for more than a week, that is when the pain is bearable. It doesn't actually stop you doing things or prevent you doing something that you like or enjoy. Then yes, we always hoping that it can heal itself, but it hasn't healed more than a week. Then yes, go to consult your doctor. Go straight away to your acupuncturist, right? Acupuncturist. Now, what if the pain is very severe? You should straight away go to see your doctor or see a practitioner, acupuncturist. That is stabbing pain and you can't move your head. Oh, it's pain. Oh, it's painful. It's painful. It's all painful. Even just one position is painful. Then you should straight away go because it's quite severe. Right? It's quite severe. Or numbness in your fingers. Or you get I can't walk properly. I got dizziness with the neck pain. That is actually compress the artery. You haven't got enough blood flow to your brain. That's why it's causing it. And then you need to straight away go to the doctor, go to acupuncturist. Right? Now, if you have severe neck pain, without any causes, you didn't get exercise, hurt, you didn't sleep on a funny position, you didn't work long time in front of the desk, and you suddenly get severe neck pain, then you need to go straight. You don't wait for 1 week. Be smart. Listen to your body. Straight away go. If you have any lump in your neck here or here, you can feel any lump that in your neck that causing the pain, suspect that's from the lump, then straight away go to your doctor. Do not wait. You don't have to wait for that. You're not going to wait for 1 week, 2 weeks, and get rid of the lump. Right? Straight away go. If you have fever, why fever? We talked about yesterday, meningitis, right? And maybe meningitis with the neck pain. Straight away go. Infection. Straight away go and see your doctor. Headache, okay? Headache, it makes sense. It depends on what type of headache. If the headache is going up, a little bit going up, it's not too bad, and that's okay. Give it a week. But if you worry, don't wait for it. Straight away go to an acupuncturist. You know, straight away go to an acupuncturist. Now, or your doctor. Swollen glands. Or swollen glands means infections. There's an infection. You need to treat the infection. Then yes, straight away go to your doctor. Nausea and vomiting. If nausea, vomiting plus fever, then go straight because that may be brain problem. It may be infection. But if the pain is very strong on the neck and no fever, but it make you like pain make people vomit. Do you know? I just saw my friend with a lot of pain and vomit. That pain make you vomit. Yes, that happen a lot with pain conditions. When it's severe, of course, if you're just a little bit painful, achy, it won't make you nausea or vomit. But it's common when the pain is so severe, it make people vomit and get dizziness. Then when it's severe pain, don't wait. Go to your doctor, get an opinion, what's going on, get some tests done. Go to your acupuncturist, get some tests done. Okay. But if you have trouble swallowing, breathing, well, we suspect that maybe heart problem, heart attack. You know, if you have pain go down here or chest pain, hard to breathe, as well as neck pain or numbness in your hand, face, go straight to your doctor. Go straight to your doctor. Right? You need an emergencies. Right? So first, better to be safe than sorry. Okay. Okay. Weakness, numbness, tingling on your hands. Numbness, tingling on your hand, and you can't hold things. And you lose the strength. It may indicate heart problem. It may indicate the nerve compressed. The nerve compressed. Oh, if you look, it just let's put it back. Right. So this is important. So you need to know all this. What are the symptoms apart from neck pain? When you have other symptoms, you need to be aware. This may be a heart case. This may be, well, now if you're a practitioner, if you're a very new practitioner in acupuncture, now you see, wow, it's not that easy to be an acupuncturist. It's not that easy just putting needle on patient. We need to know with what symptom it may be what causing it, right? If it's heart problem, if it's a metastasis, you need to do other strategy. Can acupuncture help with metastasis and heart attack? Yes, certainly. We can help. We can help with that. You know, we can also provide treatment for them. But you need to know when we treat this neck pain, we not just treat the neck. We need to treat the heart. If fever, we need to bring the fever down. We need to treat, we need to prevent the infection go further. So the strategy change. Yes, you can still treat the neck, but you need to treat the heart. You need to treat the brain. So these are all important to know. Right? People think, well, acupuncture is easy. They will just stick needle in it. And all masters say, well, if pain in here, you just needle here, needle here. It's not that easy. You want to be a doctor, you want to be a practitioner, you want to be an acupuncturist, you want to know everything about the body, all the disease. The more information, the knowledge you can get, the better, because you're dealing with life. To respect life, you need to know more and more knowledge, and never stop learning. You know, never stop learning, and this is important. That is why I'm here. Let's go through all disease one by one daily. Just a little bit in feeding you. Right? Like I said, with infection, Western doctors usually give antibiotics. Is there any way to have alternative treatment? Yes, it is. Okay, it is. First, we need to know 1,000 years ago, we don't have antibiotics. And how did the Chinese doctor deal with all infection? Infection, according to Chinese medicine, is a lot of them is 温病. 温病 mean the warm disease or the heat disease that are more associated with infection, but that is just one category, one side. Right. The another side, infection means all come to heat and warm issue. It can be cold issue as well. It can be cold issue as well. So this is important to know. So in Sanghan all the infection, depending on what type of infection, if it's a cold infection, then we use a common cold, a flu infection. There is 柴胡汤, 小柴胡, 桂枝汤, 柴胡桂枝汤, 白虎汤, 白虎汤 for 温病, and麻黄汤. This is all for infection from a cold. Okay, if you get a cold, get a flu, it's an infection. But some other infections different. If joint infection, you don't only use those. Yes, it's not a cold, a flu, right? It is a joint infection, and you have a look. You have to use Huanglian, and you have to use other formula for joint infection. Okay, bladder infection. Well, for the Western medicine, they all use antibiotics. Skin problem. I have a baby yesterday. Last week, the baby came, and the whole body had 3 months old. The baby, the whole body got eczema. Right, the skin problem, or weepy, or weight, and especially in here, and he keep doing this, scratch it, and there's all weepy and red. This is myself on the picture, and they returned it yesterday, and working very well. And they went to doctor. Doctor said, "Well, it's eczema." I asked them to go to doctor for what? For getting an allergy test. And the doctor said, "No, no need an allergy test because the baby still breastfeeding. I don't think it's to do with any food, and it is actually what an eczema. So just give it antibiotics. That's it, and some cream for the face, not for the body, not for the body." Then I have a common word for that. Okay, in my opinion, all baby things, it can be related to food. Why is that? The mother, whatever the mother having, it go to the breast milk and go to the baby. If this baby have, because I have patients who have kids, the body or eczema, and how do they deal with? And they get a test and found out that the baby allergic to milk, dairy. So the mother breastfeeding, right? Stop dairy, and the baby got better. So could you tell that the baby has not been had any food yet? Then they weren't allergic to any food. That is not right. That is absolutely not right. So when they came to see me first and they went to doctor to get allergy test, unfortunately the doctor said no allergy test because it's not from an allergy, it's an eczema, and just give her some cream for the face but not for the body. Then give them antibiotics for the baby, for the face. He got better. Got better from what? The entire body is not weepy anymore through Chinese herbs. We give her herbs to take, we give her herb to shower, to put up external use. Hi Ali, how are you? Now we need to know one thing about infection and antibiotics. Infection, it can be for virus, it can be for what? Bacterial. And antibiotics only work for bacterial, never work for virus. And we have to have this idea. Now without the Western medicine, why people getting virus attack and you give antibiotics? And antibiotics bring your immune system low. So according to Chinese medicine, when people have suffer from infections, then what do we do? In some cases, we need to bring the energy up, bring the immune system up. If the infection go into the tummy, we need to, it causes constipation. We pass the bowel motion, so we pass the infection out of the body. In your urine, you try to pass it out to the body. But if it's causing the diarrhea, then you warm the tummy up because the temperature change. In Chinese we talk about cold and hot because once the temperature change, the infection gone. Right? How does the bacteria alive? Through the right temperature, they have the moisture, which is water, those things, the temperature and the water, okay, and they're alive. So in Chinese medicine, what do? We treat the dampness, we treat the mucus, we treat the phlegm. What is it? If we try to deal with the water, because without water, they help the bacteria to grow, and we treat the temperature. If this person is heat, then we give the cold herbs. If this person is cold, we give the warm herbs. We change the temperature. Once we change the temperature, the infection is gone. So there are many, many ways through acupuncture as well. The same theory, the same thing. All right, let's keep going. Thank you for bringing up your question. I love it. Let me talk more. All right. Pain radial to your arm, to your legs. So this is all severe. That means compress the nerve or spinal cord issues, or it can be heart problem. So go straight to your doctor. Do not wait for 1 or 2 weeks. Get it checked up, get an X-ray, get a CT scan, and that's important. But sometimes you may need a blood test as well. So inability to move your arm, your hands, inability to touch your chest, your chin, all this are important. You need to go straight to your doctor. Don't wait. Okay. Bladder and bowel dysfunction. You can't control your bowel motion. It just go brr, everything out. You can't control your bladder. It's just everything out. You can't control it. So these are very serious, especially you have those symptoms that I just mentioned after an accident or a fall, or your neck hurt. Accident, you hurt your neck with the neck pain, and all this, you need to get a medical, go to emergency. Now I have a teacher, our principal husband had a car accident. It was okay, no problem at all. Walk out the car, no problem. And the car is not, it's not damaged wasn't damaged very badly. Okay, and went home, and then at night time, came. You go to hospital. What happened? The organs damaged, bleeding in the organs. So if you have any car accident, you jab yourself, your head, check your body. If there is any pain, go to the doctor and get them checked You tell them those uncomfortable and maybe internal issues. Okay, same as neck pain, accident, car accident. Go, you're not an expert. Go and see a doctor. Get them to check your neck properly, right? Because there are a lot of tests, muscle strength tests. Look at the neck function and the range of movement, and need to press on the spine and see whether there's any pain, or tap your head to see whether there's any sensation down to your hand, and hold your hand, squeeze the hand and see whether you have enough strength to hold it or not. Those are important tests to test patient, right? So that's it for today. Hope you learned something, and we talk about. I purposely bring it up for you in this. It's a small topic, but when to see a doctor, when to see an acupuncturist or practitioner, that's very very important. Very important, because it may be a big issue and may not be a big issue, but to be in the safe side, if you have those things, or be in mind if you're a practitioner, you need to know all of this, you know, and what can you treat, what can you treat, what acupuncture and Chinese herbs can assist to, do you have the knowledge or not? All these things are all important. So always question yourself. If you have the answer, you know what to do, go for it. If you're not sure, don't go for it. Refer to your doctor. Right? You have to have those knowledge. Right? Now, tomorrow we need to talk about either the test, or we can talk about the treatment. Okay? Let's see what come out. Right? So stay awesome. I need to go now. I love you all and stay awesome. I'll see you tomorrow. See you. Bye bye.